Our next honoree today is Dr. Robin Evans-Agnew. Dr. Evans-Agnew has built diverse and innovative partnerships to address the harmful effects of wood smoke and indoor pollution. His work has included partnering with the Tacoma Pierce County Health Department to engage diverse adolescents in an innovative citizen science project to collect air samples in their homes. He has also established a new partnership with Mexican-American mothers who have children with asthma, leading both to a new working relationship between these mothers and the Asia Pacific Cultural Center, and to new tool for child care, for child care centers to assess environmental risk factors for asthma. The impacts of his work range from this tool being adopted by the King County Health Department Child Care Initiative pilot, funding to support these projects, student participatory research opportunities, community capacity building, as well as scholarly journal articles. Dr. Evans-Agnew's work reflects a deep commitment to environmental and social justice issues and a dedication to bringing diverse populations together for the public good. Please join me in welcoming Dr. Robin Evans-Agnew.
I'm sort of dedicating this to the people that I know who I've been working with who are struggling. This is work that is centered on asthma, but it's also work that's centered on social justice. Last week when I met with Mujeres, Latinas, la Communidad, Apoyando, la Communidad, I heard stories of a woman who doesn't want to change all of the windows in her trailer that she lives in, even though those windows are leaking and have moisture and, oh, thank you, and have moisture and are creating mold and breathing problems for her daughter. And the reason she doesn't want to change them all is that she's saving up money in case she has to go back to Mexico after tomorrow. So that's a reality, right? I also heard about a woman whose 2-year-old niece has died. And that's another reality in our community. This is also dedicated to the boy who in my study whose heroin-addicted father sold his camera halfway through the study for more drugs. And his mother, desperate, came to me and apologized and said she'd raised the money to buy another camera so that he could stay in the study. These are proud people we work with, and I'm just overawed by all of their work. I put Dwight in the beginning there because Dwight was one of the first kids that signed up for my first photovoice study when I was working in Seattle in one of the high schools in South and Central Seattle. And I just started out on this task of recruiting kids, and Dwight kind of came to me with an affable friendliness that welcomed me into this idea that I was actually going to engage in participatory research. But I didn't realize how dangerous the work would be emotionally. I think when you commit long-term to communities, a little bit of you is vulnerable all the time for the sadness and the loss and the desperation and the inequities that you see and you witness. I will tell you that when I finished that study, I wept. I wept because of the fact that I had signed an IRB form saying that I would not contact those people anymore. I had to grieve on my own, in my own way. For the loss of that companionship and the loss of that solidarity with those 10 amazing African-American kids from interesting and backgrounds and varied opinions in their work. So I kind of committed after that to look for work that I could do which would entertain a possibility of long-term commitment, long-term work, community-based participatory research work with people, and that's really part of the story for today. I also wanted to acknowledge this work is about photovoice, and I was a fresh-faced, very idealistic pre-doctoral student who came down to UW Tacoma to talk to one of the first people who pioneered photovoice work in the nursing community in this area, and that's Dr. Christine Stevens. And she, despite all of the warnings she gave me, I continued to persevere and to try and do this work, which is dangerous work, right, for that. So I thank Dr. Christine Stevens for guiding me early on in this work. What I want to do is to talk a little bit about my partnership work, and certainly some of the intro kind of gave you some of the background with that and some of the where I'm going. And then I also sort of wanted to talk to you about what I think of the opportunities inside photovoice, this particular research method, real profound opportunities for transforming structural inequities because of the way that photovoice is accessible to all communities and all people and all ways of thinking. And I'm kind of passionate about that, and that's really where my area of research has been going for the last couple of years. I also know this guy. He's called Asthma Man, and I've never met him personally, but when I'm not around, he suddenly appears. And so never give an English chap an opportunity to wear tights. It's just a bad idea, I have to say. Part of my early work when I came to University of Washington, Tacoma, was to really begin reflecting on the voice part of this idea of photo voice, right? Photo voice is this, a way to use photographs to generate conversation and change with communities. And I began to reflect on what that voice meant. Pat Thompson, who wrote a really life-changing book for me about doing visual research for young people, stated that voice is really about having the ability to speak with the right engendered with the ability to speak, seizing hold of that right to speak. She's British, and the British believe a lot more in the United Nations and international law, and so some of those rights of the child and the right to speak is kind of engendered inside that. The other person that really influenced me was Chris Naus from here, whose book, Shut Up and Listen, really changed the way I thought about work with young people when I read it when I first, in my first year here. And he defines voice as the ability to tell your story in a way that clarifies oppression. I think that encapsulates a lot about what we try and do inside research work, qualitative research work, where we're looking to change policy and change structures. So a little bit about the two partnerships that I've worked with. Tacoma Pierce County Health Department, that's kind of like they were the critical partner with the work with the wood smoke photo voice. This is a great fun study where we had 10 youth from around the area, from around the wood stove reduction zone. We're living in Tacoma. We not only have issues with pollution in terms of water pollution, but we also have issues with air pollution in this area because of the type of air shed that we have. So what I wanted to do was to try and figure out whether we could actually measure air pollution inside people's homes during a burn ban, and a time when there would be the greatest amount of wood smoke pollution in there, and also do photo voice at the same time. And the funny thing is about the image, right, that this frozen image here, one of the great things about a photo voice and using photos instead of the moving image is that I can hold this in front of you right now. We can have a conversation about this image. Philosophers and other people have talked about the importance and the difference between movies and images. And so I'm sort of like a big fan of the frozen image right here, right now, because it gives us an opportunity for some type of reflective depth and some type of analytical depth in terms of looking at what an image is. This particular image was taken from my first study with a youth who crept into Winkos and took a picture of all of the cookies in Winkos and claimed that cookies caused asthma, which is actually kind of a really interesting discourse, because they do. So I got these kids, we recruited them, and in fact, inside this study as well, we had a great opportunity for students to participate. Dr. Maddie Brickle, who's a ED student at that time, was one of my assistant researchers, and I also had an undergraduate researcher from here who participated, as well as another student from a different college who wanted to take part in this project. So it really afforded a lot of opportunity for other students to get exposure to research work. We took photos, we discussed photos, and we took air samples in the middle of the night across Pierce County when there was a burn ban going on. I was out there in my little Honda Civic driving through the snow. Well, there wasn't any snow, but it was dark, and I had to find these houses. and pick up the air samples that the kid had run, or troubleshoot a sampling machine that wasn't working. All of this support for the sampling machines and all of that work came through a partnership with the Center for Urban Waters. So partnerships are a little bit broader than just the Tacoma-Pierce County Health Department. We had a great press day where we showed these photographs, and the kids interpreted these photographs through the text that they used. That's the key part about photovoice, is that you have a photograph, you write a text, you tell the story about it, and then you interpret that for people when they come around at these community sessions, and you help change policy that way. This is a great picture. This is one of our photovoice participants, and he's holding a picture of his neighbor's house that had smoke coming out, taken during the burn ban, in a community that's slightly affluent in Tacoma. And what I love about this is a kid who was kind of shy. He really didn't want to talk a lot inside the focus groups. And so it's awesome. This photographer got him to kind of have the photo right in front of his mouth, right? So the photo really is his voice. Another part of the context behind this photograph also is that standing right behind him is the head of the Clean Air Agency, who's bending over, packing up his bags. But he actually went back home that day. He'd just come from Olympia, Washington, who was advocating for another $40,000 to be spent in the health department for the next year for the wood stove change-out program. And in fact, they got, I think, actually ended up with something like $1.4 million for all of the air quality programs aside. Did our project help move that policy forward? I think it did. It wasn't the only thing, but it was certainly part of the impetus. And he came, and he stood, and he listened to people, and he's a policymaker. So this is what photovoice can do. This is a fun map that showed when the kids took the air samples, every single house had wood smoke inside it. Only one house was actually using and had a wood-burning stove. So we kind of knew this. We kind of know how that air particulate matter has no boundaries. It goes wherever. But this was shocking to the community members and the parents who were there. They were like, oh, I've got wood smoke in my house and I don't have a wood fire, right? I'm being exposed to something that they hadn't really realized. Another great part about this map is it shows really a great spatial distribution all around the wood stove reduction zone, which covers Parkland, Spanaway, Puyallup, little bits of Puyallup, Fircrest, and Greater Tacoma. Here's this other partnership that I wanted to work on too. This is the community-based participatory research partnership. Again, we've been able to involve students and collaborations with other faculty within this department. Dr. Ochoa Camacho is one of my partners inside this community-based research study. And the Mujeres, Latinas, Apoyando la Communidad, I was there when they decided what they were called. And they would begin to name themselves. In their initial days, they actually did a photovoice study, a very simple, basic photovoice study to examine threats to indoor home environments. And this is a World Asthma Day event that we held just next door with nursing students who got to see the women's work, and then actually got to watch and listen to a panel which included some of the women from the study talking about the threats that they face on a daily basis for protecting their children from asthma inside their home. This is at the end of this recent study that we did for the child care environments, where we developed that tool that they talked about in the introduction. This includes two of the physicians from Multicare who are partners with us, and Millie Thompson, who's my cultural liaison, who really is one of the sort of key persons helping me do this particular work. And we did a presentation to Spanish-speaking pediatricians in Multicare on the basis of what we found inside the child cares. And what did we find? We found child cares. We found 3 child cares. Two were family home childcares. Now, family home childcare is kind of like the lowest down on the regulatory rung, right? It's the ones that really don't ever get visited. They just get a license. And then there's an exempt one. An exempt one has, you don't have enough kids to have to be licensed, but you're just exempt, right? So these are childcares at the bottom end of the rung. And what did they have? They had a lot of dust issues. They had a lot of moisture issues. And they had bottles of bleach chemicals that were poorly marked and labeled for cleaning things with. And if you know anything about bleach these days, is bleach comes in 3 or 4 different types of concentrations nowadays. Bleach is actually kind of complex to create a safe solution to use. We found that all of the childcares did not have any kind of resource to go to find out about asthma, to learn about asthma, or to do any planning for children that would come into their daycares with asthma. And they wanted help. They wanted resources, they wanted support. So that's a little bit about the findings, but I wanted to talk about where I think I'm going with photo voice work and community engagement, because I think that this work is underdeveloped right now, and I think it can go further. This is a diagram of the photo voice impact model, if you like, that was kind of abstracted from all of the photo voice work. Catalani and Meredith Minkler put this together in 2010. But basically, they talk about the process of photo voice, where there's training on how to use cameras, training on ethics, and then kids, participants, community members do research, they document, they take documentary photography, right? They document things in their environment, they discuss them, and this can go in cycles, right? Some people in photo voice do it a couple of times. Once we did it we only could afford to do it once for the wood smoke photo voice study, so we had a couple of discussions in that thing. But the 3 main goals with photo voice, and make photo voice a little different than photo elicitation, which I'll get to in a little bit, is that you want people to become individually empowered, but they also develop an understanding of the community needs and assets. They develop an understanding of their environments, right? It's a community awareness raising. And lastly, that there's this emphasis on action to change policy. That's a fundamental component of photo voice that was originally envisaged by Caroline Wang when she first did her photo voice work in mainland China. Photo voice has an anthropological tradition, and someone once said this to me recently. So, well, you know, the photo techniques have an anthropological tradition, and I was like, yeah, don't get me started. Okay, I will get started. Okay, 1950s, Collier published this book called Visual Anthropology, Photography as a Research Method, and basically what he'd done in the Northeast Maritimes of the United States is he'd gone around a community. He was employed he was already a trained photographer, and he went out and took photographs and showed them to farmers. He actually went in, took photographs in the farmer's house, and then came back the next week with the developed photographs, and then they discussed them. And what he found was that as soon as he produced a photograph, he could get a deeper conversation going on. He was doing anthropology, right? So he's generating more data with the use of the photo, and the photo was eliciting the data. He held the camera, he took the photographs. He was also trained by Dorothy Lang. And if you don't recognize the image on the right-hand side, it's just because you weren't born early enough to think about this as one of the most iconic images of the Depression, right? And I have to go to my notes here because if you haven't heard the stuff that goes on with this image, you need to know a little bit about the apocrypha that goes on with this image. So this is, this person is called Florence Thompson. And Dorothy Lang was searching for an image that she thought would represent the Great Depression and the Great Urban Migration. And she snapped this photograph of Florence as she was actually waiting to go. She was in a temporary camp and she was waiting to go get work. Dorothy said, "Thank you very much," went back and developed this photograph, and it took her career to great heights. No one really thought to check back with Florence until about 20 or 30 years later, when I think it was I don't think it was CNN, I thought it was NBC or something, some other TV show. They actually went back, and you can look at the YouTube videos where they actually go back and interview her, and she's like, I did not get any money from that photograph. I didn't get anything. She took that photograph and basically left, and I never saw her again. So documentary photography is kind of a contested terrain inside anthropology, and anthropologists have been struggling with it, but also documentary photography, we think about documentary photography as the province of the press and something that it's okay to do. So the roots of photo voice, being inside documentary photography, are problematic. I think of photo voice as a transformatory type of act. These are photographs that were taken by Caroline Wang, taken by participants in Caroline Wang's study in the Yunnan province in China. And this was a World Bank-funded study that she did with 2 other researchers. One was a mainland Chinese researcher. And they gave cameras to the participants. This is not the first time that cameras had been handed to people to do. Other people had done it, anthropologists had done it, and in fact, nurses had done it. In my latest research, I found 2 nurses out of Colorado that handed cameras to people in pretty much 1990, 1991, 1992 during their dissertation research. No one had ever really done it before. I think nurses were one of the first people to do it. But anyway, I don't think Caroline Wang knew about these people. But she was certainly influenced by Wallerstein and empowerment education theory that came out of Freire and what you could do with images. A great example is this baby on the field, the woman's cutting by the field. The moment this woman showed this photograph to the other women in the discussion group, they said, this is a problem. We don't have any childcare. We have to take our kids, because we have to work in the fields. This is a problem. The women also then displayed their photographs to the policymakers. And at that point in time, some changes were made around where childcare could be done. So I think one of my innovations has really been to think about how you could analyze both the image and the text that comes out of photo voice to begin thinking about what other sorts of oppressions are happening. This is Dwight's photograph. This is Dwight taking a photograph about asthma disparities. This is Dwight actually taking a photograph of a road in Skyway, right, as he's waiting for a bus. And somehow there's a hand there, and somehow there's a pothole there. And somehow Dwight comes out with this really innovative text about why don't we have a cure for asthma? Why are we constantly talking about just managing asthma? Why are we not talking about a cure for asthma? That's an example of some kind of an intertextuality and a change in the discourse and an ability to try and disrupt policy. This latest work that I've been thinking about is really about the role between the photographer, the participants discussing the photograph, and the viewing audience. And this is, I didn't have a good picture, so I just drew this on the back of a napkin about a year ago. But there are 3 different sorts of actions happening here. The one person you don't see in this picture is the researcher. But at each point in each one of these moments is an interpretive moment. And photo voice has largely stayed worried about the photographer and the participant, with the researcher interpreting everything else. Very little of photo voice is worried about how the viewing audience reacts to the photograph. I'm arguing that unless we care about the way the viewing audience reacts to the photograph, we can't actually engage the community for social change. It's a little bit like market research. We need to understand how audiences are reacting to the photographs that the youth have taken or that participants have taken in order to achieve change. Here's a great little way, and another way that photo voice applies different disruptions. This kid took a photograph of me inside our wood smoke study, and I was a little offended because it wasn't a very good photograph of me, but he wanted to keep it. He wanted to keep playing with it. And in fact, Walker, Schratz, and Egg, when they were writing about photo techniques, had this wonderful description about what youth can do in terms of manipulating theory within a photograph. A child can take a photograph, view it, show it to the subject and others, rethink the content and the purpose of the image, improvise a response, view it and show it again, negotiate a new set of framing assumptions, something that would take a university researcher at least 2 years to do, and then take another image all in the space of seconds. So I've developed some photo voice tools over time since I've been here. One is with colleagues, Dr. Sanon and Dr. Boutain, a questioning guide for designing photo voice use with critical methodologies. That's really what came out of the critical discourse analysis work. The second is really a checklist for research design actions for photo voice. And the third one, which is in press right now, is a questioning strategy for photo voice process by methodology. A lot of people have claimed that they've done phenomenology and grounded theory with photo voice, and we've also been talking about critical discourse analysis, but there's actually not been a way to reinvent that questioning strategy that was originated by someone called Schaefer, and Wang has used Schaefer's questioning strategy for a long time. Here's my last slide, and it's really a kind of a conversation around future engagement and scholarship. I've also found that photos are really useful in my work with the Latinas, with the Mujeres Latinas. When we got ready to do our presentation on our childcare study, the women turned to me and said, "Hey, Robin, we don't really have a good picture of moisture. We don't really have a good picture of this moisture problem inside these childcares. How about you get Sylvia's picture from our first study, and we'll use that one?" And I'm like, yeah, okay, that's a good idea. So Sylvia had originally written this one. The fan is very important. It's very important that when we bathe, we use the fan and teach our children that they should use it, mainly children with asthma. So all they did was they took this same photograph and they added a working bathroom extractor fan that vents to the outside is very important. In one of the childcares we visited, we found that there was no bathroom fan. So basically, they had appropriated the use of this photo, which is a research tool for us, right? And taken it back, seized it back, and made it something that they could use as a teaching tool for their future, and a dissemination tool for their present study. The other thing that I want to do, and the last photo I took down here is of the air sampler, is that I think that what we've got to do next is be able to expand on doing both citizen science air monitoring and using photo voice on a larger scale to advance community engagement and people's voice in that work. Thank you.